And we'll continue now with integrating health metrics into corporate reporting. Brett Tromp from Discovery is our next speaker. Thank you, Brett.
Thank you. Okay, welcome everybody. Thank you for giving us the time from Discovery and myself all the way from South Africa. And I'd just like to share a bit of a success story on a bit of a partnership between the private sector and specifically the CFOs, which is what I am, and how we've managed to get the health metrics into corporate reporting into South Africa with the buy-in of the government, which we found quite an exhilarating experience. So just to give you a brief overview, because obviously when you speak from another country, people don't really understand who we are. But we operate predominantly in the financial services businesses, in South Africa, United Kingdom, we in China, we in the US, we just partnered with John Hancock. And really what makes us special in our view is what our CEO always starts a presentation with, is our core purpose. So it's to make people healthy and enhance and protect their lives. And every one of our employees that come to work live by that. It's almost that Simon Sinek thing from TED Talks, that why do we exist? And that's what we exist for. And everything that we do is built around that premise. And we have an ambition, whether we'll achieve it or not, is to be the best insurance organization in the world and to be a real powerful force for social good. So what does that mean? We were the only insurance company, and coming from South Africa, we felt kind of proud with that achievement to make it onto the Fortune Change the World list at number 17. We've done extensive studies with Professor Porter around shared value, and we rated highly in that regard as a company that lives by shared value principles. And it's not going to be part of my talk today to discuss how we do that, but and then a lot of international media. But our whole premise is built around behavioral economics, technology, and getting people active. And what we've started to see, and we've had a wellness program called Vitality that has run for 20 odd years and has probably one of the largest sets of data in the world on how people behave, is that we've really been able to see that getting people active changes the whole parameters that we work in. And we've just started to see how that evolves. And just to basically give you one example, what we're seeing now is obviously to change people's behavior, get them active. And there's a whole bunch of stats. As soon as we do that, we see the massive impact on the risk on all our products. But what we've also realized is that people want to get rewarded instantly. So we've started something called Active Reward. We've just partnered with Apple now, which is, as far as we know, one of the first insurers to do it. And how it works is that we give each of our members, we've got 3 million lives in South Africa, and we just started rolling it out there, an Apple Watch for free. And depending on how they behave, so we send them targets each month, and depending on how they behave, and if they achieve those targets, they don't have a deduction off the cost. So we see the dramatic increase in how people behave by wearing a watch and knowing if I don't get active, I get a free watch, but if I'm not active. And the same principles roll on to any of our insurance products. For example, our short-term insurance product, what we do now is we've got telematics that we developed by Rory Burns, who's the ex-mechanic of Ferrari. And then depending on how you drive, so every few kilometers, or it's 100 kilometers in South Africa, if you're driven within the parameters we say, it beeps up on your phone, go and get a free Starbucks, get a free parking voucher for the day. And we see just our accidents decrease dramatically, and it's just a way that we're sharing our value with our customers. So if you behave like that, we share with you. But that's for another day. So let me just share a little bit on why I'm here today. With our ethos, we all encourage to actively do more than our current job role describes of us at Discovery. So I was sitting in my office one day and I just started thinking about how can I influence the CFO community. It's a big community in South Africa. How do I influence them? How do I make them aware of health? And I started looking at some facts, and this was a real interesting one that got a lot of them thinking. We call it the 5-5-75, and it was derived by some physicians in Oxford. It basically says 5 lifestyle behaviors cause 5 chronic conditions, which will cause 75% of the deaths going forward. So the starting point was that NCDs, the non-communicable diseases, are going to cause far more deaths than currently the communicable diseases in the world going forward. And this was something that, definitely in the South African market as CFOs, we had never really comprehended in our workforce. That actually what people were going to get sick with, diabetes, heart condition, because they weren't exercising and they weren't eating properly, is going to have a massive impact on the workforce. So this led into some discussion, and then I looked at a few surveys done by Duke University, South African Institute of Chartered Accountants, and the CFO magazine in the States, and I looked at what are the key corporate challenges facing finance leaders in Africa, specifically looking at Africa. And what I noticed was within the top 10 issues, human capacity, productivity were issues that CFOs really worried about, but never openly spoke about. So they were saying these are issues, productivity is an issue, but they never really took it any further than that. So then what I looked at was, I took our millions of years of human life years and started looking at the data in what was happening in our populations and around the world, and started sharing this with the CFOs in South Africa. So number of employees with 5 or more risk factors, 50%, 68 of employees did not meet physical, and so on and so on, leading to a significant cost in our economy on absenteeism, actual days off work, all the factors that you hear about, but quite strangely enough, not the factors that chief financial officers actually sit down and actually look at and start being concerned about. Then I looked at Dr. Fabius' study, looking at returns and starting to demonstrate, there actually is a tangible return. It's a hard concept to understand, because for CFOs to tell them you've got to invest now and the return is in many years to come is a difficult concept for most of us to grasp. So it was just showing over longitudinally. And then one of our lecturers at one of our large universities called Stellenbosch did a similar study on our stock market versus portfolio, and we got a similar answer. So anyway you cut the data, you start to see that investing in health as a CFO is the right thing to do. It's really worthwhile. Don't look short term. And we got more and more. And I think this was a real eye-opener for CFOs. It wasn't something that was on any agenda in South Africa when you went to a CFO conference. It wasn't something that they ever spoke about. And then we got into where we report on the triple bottom line with financial, social, environmental, and really raising the question is, why are we not reporting on health? And why are we not looking at the communities around us, our own staff? And we got into that. And then the rubber hit the road. So about a year ago, I thought, well, without the government's involvement in this, it's going to be difficult to get businesses' involvement. So I managed to get myself invited to the SADC conference. And the SADC conference is a South African development community, which represents 15 countries in the southern part of Africa, so the health conference. And I managed to get a 7-minute presentation at their conference around this. And the following day, they had a closed session, and they came back and they endorsed 100% support in those 15 countries to endorse health reporting in corporate reports. So that was the first tick. We had the government behind us that set up a task force which allowed us to meet every 2 months and deal with the government. We then brought it back into South Africa. I held many workshops and sort of conferences on what we should do. It led to what we have, and just really humbly to show the support from the CFO community. We have CFO awards, and this year my team and myself won 2 awards. One was CFO of the Year under 40 and high performance finance team, voted by our peers for transformational change in this area. So we really got great support from the CFOs. People really started buying in and believing into this. We had the government support. So you can see that there's our health minister, Minister Motsoaledi. We had lots of press around it in South Africa, lots of campaigns, business reports, a lot of media getting behind it. And what happened then was that we were the first company in South Africa to include it in our integrated report. We've got a target now, 40% of listed companies by the end of next year, which I think is quite conservative. We think we will get more. And just to give you a bit of the reporting that we did, we had our Wellness Day outcomes. We spend on healthy food, physical activity events, health coach outcomes, a 10-ton challenge that we had a challenge to lose 10 tons of weight in our company. We've got great learnings out of that. There's lots of data that I can share on another stage. And then just kept reiterating the fact to the CFOs that, you know, there's real tangible performance issues and productivity issues. So just looking at our data, we've got large call centers all over the world that have similar metrics, take similar calls, and without fail, over two or 3 years of looking at the data, obviously smokers performed worse, no matter which way you cut the data. And then because we've got our vitality program, so we know actively their status, we've got their health records, we can pull all of that together. We could look against their performance metrics, and looking at someone that had poor health in our business versus someone that had good health on our vitality status, we got almost a 15% difference in performance measures, ratings from the clients. So we've actually started to get real tangible data in the business of how people behave based on their health. This isn't just fiction anymore, there's facts. And you know, the CFOs sort of started lapping that up. You know, there's now a real return. I can see some tangible benefit in it. And then just to close, to say we've got a whole program, and in line with very much with what Dr. Ron had spoke about yesterday. You know, the first real big thing is get your CEO behind it. So Adrian Gore is our founder of this company, and he lives by it. He actually doesn't believe companies will be sustainable or exist at all without have a shared value ethos. Create a culture of health. And then we just gone through the phases in all of them. Corporate reporting, we're somewhere between 2 and 3. We're well into the process of defining a framework of metrics, which we've already circulated in South Africa to get comment, and a little bit in the US, and then as we move through it. And then just from our perspective, we know, and what we can see in South Africa and what we can see in the SADC, we know this will become a reality. Governments on our side, with the big disparities between the private and the public sector, see the huge value of the private sector taking more responsibility for their staff, taking more accountability for the health of their staff instead of just trying to push it on the state. And the government themselves are going to start reporting in South Africa on this. So from a shared value point of view, we just see a great cultural and economical change if we can get people to really start taking health seriously in the workforce. So that's where we are, and thank you for giving us the opportunity to share, and hopefully we can share some more in the future. Thank you very much.
Brett, I want to thank you. You don't realize it, but for a lot of corporate people here, you've saved their jobs. Basically, we've had a CFO talk to us who's won CFO awards. And when we get that, where were you last Friday? You were in D.C., no doubt having a great time. We needed you. We were looking for you. You are to respond very quickly. The CFO talked about productivity. He spoke about absenteeism and building capacity, which will, again, stop the eye rolling. They'll say you were doing something serious. Thank you very much, okay?